Dr. Goldhamer, you've said in the past that I believe this is what I think you've said. You can correct me, but I think you've said that intermittent fasting, having dinner at 6 o'clock, being done at 6:45, and then not eating the next morning till 10:45 is a 16-hour window, and that would be something you could do at home, and it's called intermittent fasting. You've also obviously recommend that people come to True North, where they can have your full attention and have a multi-week water-only fast, and people have said fantastic, amazing things about the benefits. Aside from those two protocols, the at-home intermittent fast or coming to your facility, are there any other fasting regimens that you would recommend on a regular basis?
Well, sure. Again, not eating 3 to 4 hours before you go to sleep, I think is just good general advice. Eating, late into the night, probably not a good idea. There is some evidence, Walter Longo and others have published data suggesting that programs like Prolon and others may have some utility to people who are trying to lose weight. And honestly, anything you do to lose fat and visceral fat oftentimes translates into some, at least short-term, benefit. So if you find that not eating late at night helps you lose weight, or having a 12 to 16 hour fasting period every day helps you not overeat, that's probably a good thing. Long-term fasting is a little bit different. And if you're going to do long-term fasting, whether you do it at a facility like True North Health or you do it at home in conjunction with your local doctor, it still has to be done properly, which means, first of all, you have to determine, are you a good candidate for that type of intervention? Not everybody is. People that are on medications, people that have specific health problems may be damaged by this type of long-term fasting unless those issues are addressed properly. So a proper history is necessary. And the next thing is, if you are a good candidate for fasting, fasting needs to be done properly. It needs to be done in a resting state. If you maintain higher levels of activity, you can put yourself and other people at risk. For example, you wouldn't be a candidate for driving an automobile while you're doing long-term fasting. You wouldn't be a candidate for doing vigorous physical work. You can get dehydrated. You can put undue pressure on the kidneys. You can do all kinds of damage if fasting isn't done properly and monitored properly. And so that means you're working with a physician to review your history, to do a physical exam, and to monitor your laboratory findings appropriately. And then, very importantly, fasting termination needs to be done properly. Too rapid a return to feeding after long-term fasting can result in refeeding syndrome, post-fasting edema, dehydration, all kinds of difficulties that are very real risk factors when things aren't done right. So again, if you're fasting at a facility, presumably those issues are all taken care of: history exam, lab monitoring, post-fasting recovery. If you're doing it at home in conjunction with your local doctor, or perhaps with coaches, like our doctors do provide some remote coaching to help physicians supervise fasting for patients that are doing it at home. The principles don't change, though. The need for rest support is exactly the same. You have to have a doctor that's willing to be supportive of you in doing that intervention. And in some cases, if people are at home, a modified version of this might be safer and better. Maybe you reduce caloric intake to 600 or 1,200 calories a day. You focus on fruits and vegetables, and you show some patience, because many of these things that we treat with long-term fasting can also be treated with healthy eating over time. The problem is, it's hard to get people to make those diet and lifestyle changes when they feel terrible. And so sometimes the advantage of going inpatient and doing an intense period is just getting people feeling well enough that they're willing to eat well, rest well, exercise appropriately. And if they're patient, they can be successful. I have to tell you, a lot of people that we enroll in studies, because we're often booked a couple months in advance, we have to work with them remotely before they can come in. Many of them get well before they ever come in, because they've adopted the diet and lifestyle principles. True North Health is really good for people that they've done the diet and lifestyle, but for whatever reason, they're having difficulties. Maybe they're having trouble getting off medications. Maybe they're having problems despite their best efforts. That's fine. But for most people, most problems, diet, sleep, exercise diligently applied will result in progressive improvement and resolution of many of the problems that people suffer with.
But if someone is qualified by you, that they're a candidate to do a fast, and they get ideal coaching from you or your staff, would you at that point, for a typical person or an average person, say it's a good idea? What's the next thing? Would be a 1-day fast, 1 week fast? Like, what would you do?
again depend on their condition, just like it would if they were inpatient. And you don't know exactly what's ideal until you see how a person responds to that type of intervention. So they would be working with their local doctor. They would have had a history exam, laboratory testing. To the degree that we can be helpful, we can certainly provide them coaching in terms of advising them about symptoms that are common come up during fasting, and work with their doctor if their local doctor doesn't have as much experience perhaps in what kind of symptoms might show up in fasting. And if they're willing to rest and they're a good candidate, those results are good. We supervise a lot of we provide a lot of support for people that are being supervised by their local doctors and doing fasting or modified fasting in home settings. It's a lot harder at home to get people to rest. It's a lot harder at home for them to control the variables. And that's why we like locking people up at True North Health, because we can control all those variables. And for people that are, again, on medications, have health complications, need to fast longer than 2 or 3 weeks, they're going to need to do that inpatient. For people that are relatively healthy, that have a cooperative doctor, they can often fast anywhere from 5 days to 2 or 3 weeks successfully in a home setting. But again, I have to tell you, the complications, the problems we see in home setting is higher than when they're inpatient, just because it's easy to make mistakes. It's easy to feed inappropriately. It's easy to be too active. It's easy to get dehydrated. It's also easy to panic about symptoms that may be perfectly normal adaptations to fasting, but that worry people, particularly maybe doctors don't have much experience with fasting because they're not used to seeing people get well. Most physicians never see people get well from conditions like hypertension or diabetes or autoimmune diseases. They tell them they'll be on drugs the rest of their life, that there is no getting well, because in their experience, they don't see people get well. Only a small percentage of medical doctors are lifestyle medicine doctors that have a fighting chance to get somebody well. Most people are pushing pills, potions, and powders and treatments that have nothing to do with ever getting anybody well. It's all about managing their symptoms with drugs.
And if someone did a 5-day to 2-week fast that was qualified under your supervision with a local doctor, is this something you do once a year, every 5 years, every 10 years? How often would you do it?
So again, it depends on the patient. For healthy people, we've actually published a study recently where we got those rare people that are metabolically healthy, fasted them, and take a look at what happens to people that are metabolically healthy that fast. And what was interesting is much improvement as you see in sick people in terms of blood pressure, blood lipids, and the rest. Healthy people that start off normal actually proportionally get even more improvement than people that are sick. The people that probably get the most benefit of fasting are the healthy people trying to use it preventatively to fine-tune their diet, lifestyle, their palate. And you'll see improvements towards health even in people that are within the quote normal ranges. And again, proportionally even more so than sick people. So I do think that a period of fasting, depending on the patient, from 5 to 10 days on a yearly basis is likely to prove healthful. We're going to be doing a long-term prospective study, actually looking at what happens to people that do a whole plant food SOS-free diet and fast for a week or so a year as a preventative measure, and what happens in the last 20 years of their life. What people are more interested than living longer is actually living better. Most of my patients know they're going to die, and how long they live is largely determined by genetics and luck. But how well they live in the time they have is determined by their diet and lifestyle. And if they like to not spend the last 20 years of their life unable to talk or move, lying in some nursing home bed waiting for somebody to come and change their diaper because they've had a stroke or heart attack, the best thing they can do is adopt diet, sleep, and exercise changes today. It's healthy life expectancy we're likely to have the biggest effect on, not just life expectancy.
Dr. Hashmi, do you recommend fasting of any type for people with chronic kidney disease, and what are the results if you do?
Yeah, so what we end up doing is that when we start to talk about the underlying conditions, so if we're dealing with diabetes, we're dealing with hypertension, we're dealing with obesity, those are where we find that there's a few things that are a big issue. So the first one is people's tendency to not have self-control. One of the beauties that you find with fasting that does really well. So, when you look at head-to-head trials, the misnomer for head-to-head trials is if you just look at calorie reduction and fasting, they'll say that there's no difference. Here's the dilemma with those studies is you're forgetting all of the secondary benefits that you're having to the gut microbiome, to your metabolism, to your ability to be able to create discipline. And this is one of the things that becomes so interesting. So, for example, when we deal with patients, as long as they're not insulin-dependent diabetics, we're not worried about their crashing, pregnant people, et cetera, et cetera. After you get rid of all of those patients, what we focus on is we start with a very simple concept, which is we tell you first, we need you to have a fixed sleep schedule. So, for example, if you're going to go to bed at 10 o'clock and let's say you wake up at 6, the minimum we're asking for is 7 hours of sleep. This is really critical. And I talked about this before several times, is when you sleep less than 6 quality hours, your cravings for salt, sugar, and fat go up the next day. So that's why we recommend 7 hours, because people do end up having for 7 hours around 6 quality hours of sleep. That's number one. Number two is what we also know is the later you eat dinner, closer to your bedtime, the more likely you are to crave salt, sugar, and fat the next day. This is a fact, not opinion-based. There's many studies. You can go on PubMed and look at that data. So when we take people on this journey of fasting, we always start with this concept of working backwards from when they go to bed. Step one is fix their bedtime. Now, if you want to fix somebody's sleep, this sounds counterintuitive. The way that we do it is we always tell them is step number one is to wake up at the same time every day, 7 days a week. So do not sleep in on the weekends because it starts to mess with your metabolism and your circadian rhythm. And then we work backwards through it. So the concept here is don't take naps during the daytime. If you're going to wake up at 6, you do it 7 days a week. Now, if you can't fall asleep, so forth and so on, you still got to wake up at 6 because what we're doing is we're working on that rhythm backwards. Once we have that rhythm, then let's say you do go to bed at 10. We start with the idea of 4 hours before going to bed. We want you to focus on not eating anything. And that includes liquid calories. So it's really just water that you're going to have. And the concept there is when you look at your metabolism, on average, it takes about 4 hours to digest food. And so if you eat within that 4 hours before dinner, you're going to have food in your stomach. You're going to send blood to your stomach. As a result, you need that blood to go to all the other places that you really want. You want that deep, restful sleep. And that's where we use it, is because what we find is few things. It's great in terms of getting people on track so they can be successful in their weight loss journey in the long run. We're not doing a quick fix for them. What we're saying is these are things you can do from now till the day you die, and you can feel comfortable doing that. So intermittent fasting, sometimes people start to look at buzzwords like plant-based diet. These aren't buzzwords. If you understand what you're trying to achieve behind it, you can actually find that there's a lot of benefits. It's where people will take that concept, not fully understand it, and implement it without any supervision. That's where it becomes tricky. And that's our job, is to be understanding of what's the safety, who's the right candidate, how do you apply it, what does success mean? What are the metrics you're going to measure to say, is this working or is this not working? And in our weight loss patients, what we find is the concept of fasting is really helpful for discipline. One of the worst things that we've taught people is if you want to be healthy, just graze all day long. Keep eating more frequent meals. And they keep doing that. And every time you eat, you cause an insulin spike. The insulin spike goes down, crashes your blood sugar because you have insulin resistance. So now you ate something. 2 hours later, you're hypoglycemic. It's reactive hypoglycemia. And so as a result, your appetite shoots back up. So you get on this vicious roller coaster. And what we're trying to do is get you off of the roller coaster.
Our experience is very much the similar, that once people adopt an exclusively whole plant food diet with lots of vegetables, get rid of all the refined carbohydrates, a lot of the insulin effect is diminished, and the cravings, the binges, a lot of that stuff disappears. It's much easier to regulate dietary control in people who are not having their blood sugar levels bouncing all over the place.
You said that you recommend that we get up at the same time every morning, like 6 a.m. or 7 a.m. But there's a lot of people that are saying that sleep is very important and it impacts Alzheimer's prevention. So if you know you've had a rough night and you were up half the night and now it's 6 a.m., if you follow what you're saying, you'd get up at 6 and that would get you on a cycle. But on the other hand, you missed a whole bunch of hours and you'd rather sleep till 9 to try to catch up. So which should you do?
So this is where, You know, the problem with nutrition and the problem with health is we always go to the extremes of concepts. And the extremes of concepts is what gets us into trouble every time. So, to your point, Steve, when we take a step back and we look at sleep hygiene, what exactly is sleep hygiene? Is sleep hygiene that we come home, we're stressed out, we turn on the tube, we lay in bed, we watch it, or we're on our phone surfing the web uselessly, and now we wonder, why can't we fall asleep? And so to make up for that, we're saying that we shouldn't get up at the same time. But what I'm saying is quite the opposite. First, you have to create schedules in life. And this is the same thing, by the way, when we have patients trying to lose weight, is what we tell them is the more times you have to make decisions, the more likely you are to overeat, the more likely you are to make mistakes. So the idea behind getting up in the morning is also then you work backwards to make sure that, let's say your bedtime is 10 o'clock. Then starting at 8 o'clock, what are you doing? All electronics are off. What's your bedroom like? Do you have all sorts of bright lights in there? What do you do on the bed aside from sleep and sex? Do you do other stuff? And if you do, why? Do you read stuff? Do you watch TV? Let's minimize that. Let's make the bedroom the sort of sacred place where you do only two things. That's important. Next is what's your routine leading up to bed? Are you like, it's late, it's 2 a.m., let me just turn the lights off and fall asleep? Now, that may sound like a great idea, except for you're not training your body. At the end of the day, there's only two kinds of people. They're either trained or not trained. You can look at any Olympic athlete. They don't just go out there and compete in the Olympics. They spend a lifetime of training. When we talk about appetite, we talk about even diseases like diabetes, blood pressure, obesity. What we're talking about is helping people to build resilience, to build habits, and those habits translate. So it's not making an excuse. Oh gosh, some doctor on the internet said I got to wake up at 6. You don't need to wake up at 6. Let's say you wake up at 7. Let's say you wake up at 8 every day. I don't care. What I care about is that you make sleep a priority. And what it means to make a priority is you're waking up at the same time every day, building those habits and minimizing distractions so you can start to build that cycle. Lack of sleep happens because we have so many unresolved issues all throughout the day. We don't have those issues when we're trying to understand that there's a cycle we go through. A lot of people, when they toss and turn, if they think about the dreams they're having, oftentimes it's because there's all this stuff in their head that they haven't resolved through. And that's where schedules become so important. Whether you're into meditation, you're into religion, whatever your thing is, you're into yoga, you have to find what allows you to let go. Letting go is the hardest thing we have. You know what's fascinating is we can't change the past. We have no clue what's going to happen tomorrow, yet we obsess so much about yesterday and tomorrow that we forget the only thing we know is this moment right now, the present. And truly, that's, when people say this on movies and stuff, today is a present, it is. It's the gift that you and I are breathing. But you can't control tomorrow and you can't control yesterday. And those thoughts are going to drive you mad. But if you want to get better sleep, you need to work backwards. That's not the only way to do it. One way is to work backwards, work on sleep hygiene, work on schedules, get rid of stimulants. We talk about half-lives. And in medicine, half-lives is a very big thing gets thrown out. And so people say for caffeine's half-life is around 4 hours. Nobody cares about half-lives. What you should be asking is, what is the quarter life? Meaning, what's 2 half-lives? Because there are people who can drink coffee that are slow metabolizers, and they can drink coffee at 12 noon, and at 10 o'clock, they got plenty of caffeine in their system. So what we tell people is you want to, if you're somebody who's sensitive, you got to stop drinking caffeine before 10. There's all these little things that we do every single day that builds habits, and habits are a recipe for greatness. Greatness is not an accident, and greatness is not luck. It is doing the same thing every day when nobody's watching.